Welcome back. For decades, the UK has been an attractive job destination for foreign nurses from countries such as India and the Philippines. But recent changes to UK immigration law have made it tougher for them to attain permanent residence or permission to remain.
Now, there are concerns, I should say, that these changes could impact staffing for a healthcare system already under strain. Here's Stuart Smith for CNN from London in the third part of our series on the global migration of nurses.
25 years ago, Louis Horn left the Philippines to become a nurse in the UK. Back then, she found she was just one of 5 foreign nurses at her hospital in East England. Fast forward to the 2020s, and for every UK-trained nurse joining the National Register, an internationally trained nurse joined too. But last year, that changed. The government tightened entry for overseas nurses to try to lower record-high net migration numbers. Visas became 7% more expensive, and foreign nurses in the private sector may now have to wait 10 years for settled status, rather than 5, to live in the UK indefinitely.
It's very important as a trade union for us to protect these workers, to make sure that they are safe where they're working, they're not treated unfairly, and that we don't increase the vulnerability they're feeling by giving them these new visa rules that restricts them from staying here.
Around a fifth of the National Health Service workforce was born overseas. Half of those are Asian, mostly Indian and Filipino. It underscores that international perceptions of life here are vital to recruiting the healthcare workers required to sustain the system. As London attempts to reduce reliance on international workers and the number eligible for permanent residency, the UK's care sector for elderly people has seen an even greater shake-up. Care homes are effectively banned from hiring abroad. They can no longer sponsor the visas of any applicant who is not already living here legally in the UK. The government told CNA that's also because there were unacceptable levels of abuse and exploitation of arrivals, in some cases leading to debt and mistreatment. With salaries limited, international recruitment essentially forbidden, and a growing elderly population, the care sector is worried for what's to come.
We cannot accept applications from overseas, which is devastating, and what they've said is that we can only recruit migrant workers that are already in the United Kingdom.
That's particularly frustrating as Mr. Segal found success recruiting from southern India, and the government may still change the rules for those already here. That's left some of his staff feeling uncertain about their future. Alamin Mia came to England in 2021 to study business administration. He graduated from university in Bangladesh but struggled to find fulfilling work there. He's now a carer in rural East England.
It's very difficult to survive here when you are working in care sector, but if you see what we are doing, we are giving our best. We are working very hard to support people.
The government is creating a new body that will negotiate pay between trade unions and employers, which it claims will be raising care workers' salaries by 2028. Too little, too late, says the care sector, which believes that won't be enough to encourage enough domestic workers to fill the gap created by the sharp fall in overseas recruits. For CNA, I'm Stuart Smith in London.